Thank you, Mr. Chairman. Good morning, and thank you all for being here, for your testimony, and for your service to try and address what is obviously the worst threat to Americans in my lifetime. I am particularly concerned about the impact on older Americans and those in long-term care facilities. In New Hampshire, 80% of our COVID-19 deaths had been in long-term care facilities. That's the highest percentage in the country. I'm concerned, as you talked, Dr. Redfield, about how you prioritize who gets the vaccine when we have one. How do you prioritize these residents and those with underlying conditions like diabetes?
Thank you very much, Senator. A very, very important question. Obviously, this is going to be discussed through our advisory committee on immunization practices, but clearly the most vulnerable and those individuals that are at greater risk for mortality have to be highly considered, as well as those individuals at great risk for infection because of what they do. Turns out among healthcare workers that get infected, we've recently looked at it, turns out the most common healthcare workers that got infected were the non-nurse, the sort of the caregiver in the nursing home were the most common there. So these are going to be critically important. I will say one thing though, depending on which vaccine is approved, it may have particular characteristics that make it more or less appropriate to begin with in different populations. And this is why I think it's hard for us to know exactly until we know which of the viruses. But clearly the vulnerable are going to be, if not the top priority, one of the top priorities.
And do you have a timetable for when you're going to make those decisions? Because obviously things are moving rapidly.
Yeah, there's discussions already going on to work frameworks for it, but as I mentioned, at the end of the day, it's going to really be dependent on the characteristic of the particular vaccine product that we're now planning to do.
Staying with you, Dr. Redfield, last month the Agency for Toxic Substances and Disease Registry issued a statement expressing concerns about the relationship between exposure to PFAS chemicals and the risk for COVID-19 infections and complications. In New Hampshire and in communities across this country, we have a number of people who have been exposed to PFAS who are very concerned about this statement. So can you tell us what the agency is doing, what CDC is doing to assess the impact of PFAS exposure on COVID-19 risks?
Yeah, we're currently working, both of our Agency for Toxic Substances and our Flu Division are working together in a study to try to learn better about the interrelationship between the PFAS serum concentrations, for example, and the association between symptomatic or asymptomatic COVID infection, severity of symptoms, and hospitalization. So we do have a study ongoing to try to understand that association, Senator.
And do you have any timeline, again, for that study, when you expect to have data that could give us some insights on that?
I think I've really learned that I have to be careful in trying to predict. You know, as my colleague, Dr. Collins said, science has its own timeline.
But do you think we're talking months, years, decades?
We're not talking decades, okay? But obviously we're trying to get that information as soon as we can. And I really am not able to commit how fast the science will be done, Senator.
Well, it seems to me that would speak to trying to address PFAS exposure wherever we can. I think this is for you, Dr. Disbrow. As we're talking about the challenge in this pandemic, one of those, in testing at least, has been trying to provide access to all of the ancillary supplies that are required. I think that is probably going to also be true as we think about the vaccination plan and distribution. We've heard from one manufacturer in New Hampshire who makes syringes that they need some certainty so they can order the equipment they're going to need to make those syringes that are going to be available for vaccinations. So can you give us any details on the anticipated timeline for the award of contracts for production and supplies?
Sure. Thank you for that question. So as everybody knows, making a vaccine is more than just making the bulk vaccine. There are multiple steps involved. You have to have fill finish capacity. So BARDA is working very hard with our partners, the Joint Program Executive Office, CBRND at DOD, as well as under OWS, to reserve excess capacity for fill finish so that you can not only make the vaccine, but you can fill it. We're working with JPEO to expand capacity for vials because you need the vials to put the vaccine in. We have awarded contracts for needles and syringes, acquiring needles and syringes. We're also working with JPEO to expand capacity for needles and syringes so that there are sufficient needles and syringes when the vaccine becomes available. So we're working on all aspects of the vaccine. There's also kitting. When you send out a vaccine, you have to have, the needles and syringes, alcohol wipes, Band-Aids, all of that. And then there's the distribution. And as Dr. Redfield mentioned earlier, it is very important that the people who are developing the vaccine, and under Warp Speed we are tied in with the group that is talking about distribution and kitting, because they have to know what that vaccine is going to look like. Is it a single-dose vial, a multi-dose vial? What is the cold chain requirement? So we are working across Operation Warp Speed in multiple different work streams that are fully integrated.
Thank you, Senator.